Still ahead on 9 News at 10.
I woke up the next morning with my arms looking like I'd been through a fire. I mean, it was terrible.
Second and third degree burns on arms and elsewhere. Many women are finding out the risk after the damage is done. What you need to know before getting the latest cosmetic treatments. With more and more people trying everything from Botox to chemical pills to laser hair removal, dermatologists are seeing an increase in people who've been burned literally. 9 News reporter Gina Kim shows us the risks of those cosmetic treatments and some things to watch out for.
We'll call her Susan. She doesn't want to be identified, but she does want other women to learn from her story.
My skin was so tight I thought it was going to split my face, and 2 weeks after that I was shedding like something out of an American Werewolf in London. Huge chunks of skin were coming off.
Susan was badly burned by a chemical peel, a popular procedure among millions of American women.
Chemical peel actually puts some type of acid on the skin where it actually interacts with the top layer of the skin and damages it, so that 2 or 3 days down the road it actually peels off like a sunburn.
Susan got burned 10 years ago, but it's only now she feels comfortable in her own skin again.
For 5 years the coloration was so bad I wouldn't let anybody take my picture. I wore makeup for the first time in my life and just plastered it on.
My arms haven't seen sun in months.
Shelley Canales was burned too, except hers came from a laser hair removal procedure done on her arms last August.
I'd gone a few times before, and to the same place, but I'd never had my arms done, and that was the first time the laser had ever touched my arm, and I had an adverse reaction.
Canales spent hundreds of dollars to get the laser treatment, then hundreds more to undo the damage.
I mean, it was terrible, terrible damage to my skin.
There are lasting damage and complications with especially laser treatment.
Dermatologist Stephen Eubanks says as the popularity of cosmetic procedures skyrockets, so do the number of injuries, and women need to know that just about everything comes with risks.
There's scarring, there's permanent skin discoloration, either too light or too dark. And these are things that patients need to understand before they go into a procedure, that that's a possibility. It's not common, but it can happen.
As the industry continues to build, there's more and more people that are not qualified that are doing the treatments.
Pamela Good is the Lakewood esthetician Shelley and Susan both turn to for help. She says women need to do their homework before doing any skin procedure.
Don't be afraid to ask questions. It's your skin.
Susan and Shelley both thought they had been extra careful. They say it'll be a while before they feel safe getting a procedure again. Gina Kim, 9 News.
Shelley Canales had her laser hair removal done at a salon without a doctor present. Dr. Eubanks says it's not necessary to get a cosmetic treatment done by a doctor. What matters most, he says, is their experience level and testimony from previous customers.
A story of beauty versus medicine, cosmetic procedures becoming more and more popular, procedures like laser hair removal.
But who is performing these procedures? It is tonight's Unit 2 Consumer Alert. Natalie Tisdall joins us tonight with what some are calling a disturbing trend.
Wendy and Ernie, last year close to 7 million cosmetic procedures were conducted in the United States. A majority of these are non-surgical. You walk in and you walk out, usually with no problems. But for one woman we talked to, the result was not a pretty picture. I felt like I had to hide myself.
Shelley thought she was doing something good for herself when she went to a salon for laser hair removal. As an aspiring singer and actress, her arms are often exposed. She hoped the procedure would eliminate the dark hair on her arms.
At the time, I didn't realize how dangerous it could be because it can go terribly wrong.
It did go terribly wrong. This is what Shelley's arms looked like after the laser hair removal.
I think it's primarily a lack of supervision.
Dr. Richard Ort is a dermatologist who specializes in laser hair removal. He tells us that every month he sees patients with injuries from treatments performed without a doctor's supervision.
There's a huge demand for laser hair removal, and I think that as these technologies develop, they outpace the laws that exist.
The law in Colorado, or lack of one, seems to be the issue.
I believe that using a laser is actually the practice of medicine. So I don't think that a person should be allowed to practice medicine without a doctor being physically on site at all times.
We talked to the Colorado Medical Board and discovered that Colorado is one of 10 states that allows doctors to delegate laser procedures. That means that a doctor does not have to be on site and anyone can perform these laser procedures.
This is one type of laser hair removal machine. The light actually comes from here, and there is a very cold tip that keeps the skin from burning. Used properly, this is a very effective and safe machine.
It can be very damaging. I mean, I honestly didn't realize just how awful it could be.
You'll find various doctors signing on to clinics that do laser hair removal, plastic surgeons, ER doctors, even dentists. The fact is that it's a moneymaker for them. Doctors get paid by just having their name associated with the procedure, even if they don't do it themselves. And Ernie and Wendy, if it's something someone is considering, first of all, find out about the laser technician, what type of training they have. Secondly, find out about the doctor and see what type of training he or the woman has or the man has, what kind of experience they have with lasers. It's very important that you do the research, as you saw in the story.
Well, it's appealing because nobody likes to shave.
That's
I mean,
right.
everyone's looking for the new option to not have to shave.
Absolutely. It's very
so.
appealing. You just got to be careful. Do your homework.
Yep. All right.
Okay, good
Thanks,
advice.
Natalie.
Thanks. Good story.